49 dental officers interns, 616 pharmacist officers interns, 2,424 Bachelor of Science nursing officers interns, 705 Bachelor of Science clinical officers interns, and finally 2,096 clinical officers interns diploma. This achievement represents more than a workforce deployment. It is an investment in Kenyans' national health security. A resilient health system depends on a sufficient, competent, and equitably distributed health workforce, which is capable of responding to disease outbreaks, maternal and newborn emergencies, trauma, non-communicable diseases, and every emerging public health challenge in our country. Every intern joining our facilities today strengthens Kenya's capacity to detect, to prevent, and respond to health threats while ensuring that essential services remain available to every of our citizens. The government has therefore committed 9,365 million in the 2026-2027 financial year to finance this internship program. It is one of the largest annual investments in the health workforce development in our nation's history. At the onset, I want to thank the President, the National Treasury, Parliament for prioritizing this funding, and colleagues at the Ministry of Health. This demonstrates that health care workers are not merely an expenditure. They are a national asset whose development determines the success of the universal health coverage and the well-being of our people. Today's event also reflects the progress we have made in restoring order and predictability within the healthcare sector. When I assumed office, delayed internship postings, and resolved human resource matters, and industrial unrest threatened health service delivery. Through collaboration with our professional councils, unions, our county governments, and development partners, we have progressively resolved many of these long-standing challenges. We have restored confidence in the internship posting. We have advanced UHC staff agenda and created an environment of industrial harmony that allows us to focus our collective energies where they belong, and that is serving Kenyan patients. This stability comes at a particular critical moment in our healthcare sector transformation. We are implementing some of the most history. The Every Woman, Every Newborn, Everywhere Acceleration Plan, the Maternal and Newborn Health Rapid Results Initiative, the nationwide improvement in quality of care and patient safety, the continued rollout of the universal health coverage through the Social Health Authority, and the rapid digitization of health service, to mention a few. These reforms require an energized, adaptable, and a forward-looking workforce. I therefore urge every one of you to quickly acquaint yourself with these national priorities and become active participants in transforming healthcare delivery. I am particularly excited that this cohort largely represents a generation that is technologically savvy, that is innovative, that is deeply committed to making a difference. Around the world, are increasingly being shaped by young professionals who embrace digital technologies, artificial intelligence, data-driven decision-making, and the new models of patient engagement. Kenya has a unique opportunity to harness your energy, your creativity, your passion, and your innovation to build a health system that is more responsive, that is more efficient, and that is more patient-centered than ever before. We expect you not to simply to fit into the system, but to help us improve that system. As you begin your careers, the speech last night, it's the last paragraph I think I felt it's important. As you begin your careers, because I'm not a medical doctor, and many of my colleagues here are 23 and the 23rd Minister of Health in Independence, Kenya. I think not 4 of them were medical doctors, including a man I have a lot of regard for, and one time was the president of Kenya, Mwai Kibaki. So the rest were politicians. But as you begin your careers, remember that internship is not merely training. It is the beginning of leadership. Many of Kenya's distinguished healthcare leaders once stood here exactly where you are standing today. Among them are professors can become tomorrow's Director General of Health, can become tomorrow a researcher, an innovator, a hospital chief executive officer like Kenyatta National Hospital, or a global health leader like many, many other Kenyans who I can name them. I want you to dream boldly, prepare diligently, and your excellence relentlessly. As a government, our policy does not end with your posting. We recognize that challenges will emerge during the implementation, as they do in every large national program. Let me assure you that the office of the Cabinet Secretary and that of the Principal Secretaries and the Director General and the CEOs of our regulatory bodies remains open to constructive engagement through established institutional structures. We encourage continuous dialogue with your supervisors, regulatory councils, professional associations and unions, so that emerging concerns are addressed early, professionally, and within the framework of the law, and do not allow to be mistreated. Please, no health facility should mistreat you. No health facility. You are a Kenyan, you have the right to work in any public health facility. Do not allow. No Kenyan is superior than the other. We have been given positions to hold, even as a superintendent of an hospital. Please, where you go, serve the community and do not allow any other person to mistreat you. We encourage continuous dialogue with your supervisors and make sure they bring any issue to our attention. Sustainable solutions are always built through partnership, through matrix that our internship programs remains transparent, accountable, and firmly anchored in saying we must do it in public. Saying we must do it in public. To our interns, I once again say congratulations again on you reaching this very important milestone in your career. You joined the health service at a very defining moment in our nation's history. The future of Kenyan healthcare system will increasingly rest in your hands. And I want to tell you, as the Minister for Health for the last 18 months, Kenya has the best healthcare system. You can't compare us with any country in Africa. But we must be the best in the world. And we will be the best in the world. We must serve with courage. We must learn with humility. And we must innovate without fear. And we must uphold the values of professionalism and integrity. Above all, remember that every decision you make has the potential to change, protect, or save life. You know, your union, our union leaders, Dr. Devji and Panyako and the rest, they are very good people. They were only lucky who to engage. Let me speak for them today. The leadership, you know, the first day I came here, I told the last interns when I was launching, the first day I reported to this ministry, this door was blocked by colleagues like you. So I came in. So after 1 hour, I asked, then how do I leave? How do I go home in the evening? Then they told me, no, there's a route you'll use through Ministry of Agriculture. Then I told them, but that door belongs to the Minister for Agriculture. The Minister for Health, his door is here. And I had to walk out and address that time it was the UHT staff. I had to address them. And today I'm very, very happy that I have resolved the issue of the UHT staff. And I want to make it very categorical that the budget of 8.9 billion is in the budget to transit them from contract to permanent and pensionable terms. The President of the Republic of Kenya has made a pronouncement to that effect. And I was telling my PS, you know, nobody can countermand in the executive, can countermand a directive of the have to implement the every woman, every newborn, everywhere, and reduce the maternal and newborn mortality rates in our country. We must invest in healthcare workers who can help us. If I tell you under the SHA ecosystem, how many mothers died? Every night I get, how many mothers died? In which hospital? In which county? How many newborns died? Because now we have digitized the whole healthcare system. And the leader of the KMPDU, I want to assure you that we will also, I will go and convince the President, the National Treasury. And you know, as a former majority leader, I have a very strong convincing powers. When I talk to Parliament, they listen to me. Not because I'm unique, but as a former senior ranking member. And when I talk to the President, he listens to me. And I'm not asking for personal. I want him to help us employ at least 2,000 medical officers. Because every time I go, I meet Kenyans, they used to ask me 2 questions. I'm sure from tonight they won't ask me. You know, even when I walk where I live. Minister, when are you posting interns? My son is a doctor. My daughter is a nurse. Then the next question was, when are you? My son, my daughter has done healthcare profession. They are jobless. They are at home. Leaders must look for solutions. So we must address. We can't address it. Can't address it now. Because these interns, after you finish, you need to get the jobs. So we will make sure that we also look at the clinicians and that. I think your salaries are there, and I have told my team led by the PS this morning. Please make sure you give the right bank accounts. Yeah, so that you get your money by end of July. I get my money, my salary 27, 28. They should get their salary 27, 28. Yeah. Because my money is in the budget, their money is in the budget. Am I right? Yeah, my money is in the budget. My salary is in the budget. Their salary is in the budget. So if I get on 27, in fact, they should get 25th before the minister. Yeah. You know, I always tell PS Mudoni, those ladies, community health promoters, the men and the women who help us, they are called the CHPs. I tell them their salary is very little. Why can't you pay them from the 20th or 21st, 22nd? The president says, you know, one time he said, our elderly people, you know, the little money they get, the disabled, the elderly people. He said they should get their salary, their stipend before cabinet. Am I right? So these people must get their money. And you know I have a problem. You are filling my telephone. I don't know how you get my telephone. I was asking, how come my telephone is... Even last night, there were people saying, oh, you know, we are not in the list. I was asking. So I was asking now. And you know, I have a culture, I must respond to every text message. Whether I know the person or not, I have to respond. So even where I have no answer, there are two words I use. I say copied or noted. So if you see copied or noted, that I'm looking for the answer, either from PS Mudoni or PS Olugo or the DG. But it's good, you know, it is good courtesy when somebody sends you a message. It's good not to ignore it. It's better to say, I don't know. So good people, you don't know what this number means. I spoke to one governor this morning, and I asked the governor, do you know we are sending over 125 nurses to your health facilities? And you are not paying for. And we are sending over 10 medical doctors to your health facilities. And you are not paying for. And we are sending this number of clinicians. This number of Bachelor of Science, Bachelor of Nursing. And you know, he was shocked. I told him, don't be shocked. What you do, take care of my people. Yes, I told him, we are giving you people to go and work in your facilities. And I will do something I have not done last year. I want you to give me the list. I will write an official letter to each of the 47 governors, telling them that this is the number of interns we have posted, and you must make sure their training, their internship is done seamlessly, and they should not be mistreated. I'll put it in writing. So somebody does not say, oh, you know, I didn't know. I must do that. Whoever is PS, we do that so that our good people. I think I have said enough. Thank you very much. Please take your letters. Nobody this year, we don't have any problem. Universities that have not graduated their students, they are not qualified for posting. That should be very clear. So Kenyatta University, if they have graduated, we can discuss SG. But if they have not graduated, they will not be posted. Finishing is about graduation, am I right? Yeah, there are people who came last year here, oh, what, I'm graduating next week. No. Don't waste your time. And you know, graduation is not under the Ministry of Health. It's under the Ministry of Education. Please go out. There's a law that is coming out of Parliament called Quality of Care and Patient Safety Bill. Nobody has addressed the care of a patient in Kenya. That is my agenda. If you see 3, 4, 5 mothers sharing one bed, please, in your hospital where you're working, please tell us. A patient requires dignity and care, and that law is defining it. But you'll not find them because before, under the former NHIF, 3 mothers who were in one bed, who don't know each other, different disease, and some on the floor, all of them were being charged as beds to NHIF. Because of digitization, right now SHA will only pay. Digitally, I can, from my office and the PS's office, we can tell the bed occupancy. How many people slept in Kenyatta last night? How many have been admitted? The theaters, how many patients are? The kind of digitization going on in our country, many countries in Africa are coming to learn from us. So please, as you go, be our eyes. Make sure the patients that you treat also get the dignity and the care they deserve. Because they are like you are members of your family. You know, when I went to Parliament, I asked, and I was told, why are you not allowing people to share beds? I asked the parliamentarians, let me ask you, will you allow your wife to share a bed? They said, no. Okay. About your sister? They said, no. Okay. Then why do you allow your voters to share beds? Yeah. Am I right? Am I right? Is that morally right or wrong? What is good for your family must be good for the whole citizens. And you must clap for me because I didn't want to come here. You saw me last week going to court. Imagine if I didn't go to court, I could have been addressing this gathering illegally because I could have had a warrant of arrest. But do you know why I went to court? Because I participated in the making of over 1,600 pieces of legislation when I was a member of parliament and a leader of majority that the courts are implementing. So I will be the last person in Kenya. I will be the last person to defy a court order. So I went there, nimeenda nimejitetea. So nyinyi pia mkipata shida, mwende kotini. We must, all of us, be people who respect the rule of law. And you must respect the Health Act. Musome sheria za zinahusu afya. Some of you, one day you might become the DG, the Director of Health, Dr. Amoth. One day you might become Dr. Oluga and Mary. One day you might become part of this whole directors and deputy directors. Can the directors all stand up? You know the ones introduced. Yeah. Yeah, these are all the directors. And they are all substantive. Nobody's acting in MOH anymore. Thank you very much. So when you see them, you know these are your colleagues and they're your leaders. Is there anybody else you have left? Yeah. The chair of Kenya Dental Association. This man harassed me. Yeah. And he's making a lot of sense. I won't say what we are discussing. But when he convinces me, I'm going to pick the hammer. So those who are doing oral health, you are not dentists. Unanisikia? Yeah. It's good niwapatie muktasari wa habari. Universities that are training something called community oral health is not and shall not be a dentist. Yeah. You know this country, we now it is Afi House. Last time the people who came, I told them I'm not sure I'm cleaning, but now I can confirm this is now Afi House with very good men and women. So community oral, he has been texting. Again, I'm not a doctor. At one time I was about to tell him, can you engage Dr. Oluga and the DG? But he makes a lot of sense. You will only treat a Kenyan patient for what you have been trained for. Am I right? Do you agree with me? Or you want a quacks? Or you want somebody to take your jobs? Every Kenyan will be treated and will be given care by healthcare professionals who have gone to school and who are trained in that particular scope of practice. And the Director General has instruction and he is implementing that in another 1 month, we will produce the scope of practice. So that we know, you know, UHC, when we were vetting the UHC, and Panyako is here. Yes, we found plumbers. We have removed 214. There were plumbers, there were saloonists. I don't know who employed them. When did a plumber become a healthcare worker? Anyway, that story is for another day. The people who employed them were here in Afia House many years ago during COVID. But what we did with Dr. Luga, we told them, okay, fine, you have taken enough money. The agencies that will recover your money, they are not here. They will find you. You go home. So we must, the person, a nurse, for example, is very critical. Nurses are very critical in the chain of our healthcare delivery. You know that? Even me when I become sick, clinicians are very critical. Different cadres of doctors are very critical. There are places in Kenya where clinicians do amazing job in far-flung, undeserved parts of our country. So thank you very much. Thank you for coming to your building. You're not coming. This is the Afya House ni yenu. Umekuja nyumbani, mwende mufanye mahospitali pia ni nyumbani kwenu. Salamieni your families and everybody. Please, we are proud of you and we know you are going to serve the people of Kenya and make sure that we will support you and make sure universal health coverage is achieved and is achieved for the betterment of our country. Thank you very much.
Another round of applause for our super CS. Simameni tupige tu makofi. Vizuri. Thank you, thank you. Thank you so much for your speech, CS. Please sit down. At this juncture, I would love to invite you, CS, to present letters by CADA to some of the interns who are in the house today. And the first person that we wish to present to is Gloria Chepkurgat Tirot, a BSc clinical officer intern who is scheduled to report to Kitale Level 4 Hospital on the 1st of July, 2026. Gloria, where are you? Don't tell me you missed this. What happened? You picked somebody who is absent. Is Gloria here? Oh, this touches my heart. Gloria. A round of applause for Gloria. And respect to all mothers. Kuja na mtoto. She's part of the success. Hapo sasa. A round of applause to Gloria. Thank you very much. Gloria, kazi ni kazi. Si ndio? Na yote tisa, sisi tuko hapo, tukisaidiana. The second one, Waziri, is Onami Eja Mogoa, a BSc clinical officer intern, scheduled to report to Meru County Referral Hospital on the 1st of July, 2026. Eja. And I want to ask my team to redo that letter. It has a spelling error on the name referral. The third one is a clinical officer intern diploma, reply 2026. Stephen Irea Epasait. Stephen Speed plus quality. Speed plus quality. Stephen, congratulations to Stephen. Followed by Victoria Boke, officer intern.
Mnacheka lakini huyu ni mtu wa Lodwar. He's going back home. Ajoka ni.
Victoria Boke, are you here? Victoria Boke is a clinical officer intern diploma reporting BSc nursing officer, Kenyatta University Teaching and Referral Hospital. Jemutai. Oh. Caleb Wafula Wanyonyi. Caleb Wanyonyi. Jumuiya Hospital Huruma. Aya, patia waziri. Nursing, BSc Nursing. Another BSc Nursing, Onyango Brian Ochieng, reporting on 1st of July. Chuka Referral Hospital. BSc Nursing, hujamalizia Panyako? Referral Hospital, Chebet Mercy Koril. Pharmacists, Chair, Pharmacy and Poisons Board, together with Davji. Dr. Amos Okwiri Onyango. Oh. Dr. Amos Okwiri Onyango, pharmacist intern, reporting 1st July, Good Life Pharmacy. Grace Kisilu, pharmacist intern. From 1st of July, you will be reporting to Kitui Referral Hospital. Kelvin Mogambi Mwenda, doctor, pharmacist intern. From 1st of July, you will be reporting to Kenyatta National Hospital. Mariam Jilo. Mariam, pharmacist intern, reporting to Kenyatta National Hospital from the 1st of July. Medical officer intern, Dr. Khalid Abdullahi, Kenyatta National Hospital. Charles Wahome Maina.
Dr. Devji anaangalia pesa. Nimemwambia my friend, I have done my homework. You are the one who said I'm a mathematician. So hii pesa ni sawa.
Thank you. Charles Wahome Maina, medical officer intern, Murang'a County Referral Hospital. Medical officer intern, Dr. Mariam Ismail Mohamud, Mbagathi County Referral Hospital, report from the 1st of July. Dr. Christopher Makanga, dental officer intern. From the 1st of July, you will report to Jaramogi Oginga Odinga Teaching and Referral Hospital. And finally, And finally, Dental Officer Intern, who will be reporting to Nakuru County Referral and Teaching Hospital, Dr. Oira Grace Faith. A round of applause to all of them. Each one of you will receive a letter as such. Thank you. Thank you, Waziri. Before you leave this compound, make sure you have received your letter. Make sure you have given us the correct and accurate details, because we do not want to have a cat and mouse game that you gave us a different name, different bank account, and then when your money does not hit the account, you blame the ministry. We want you to be as accurate as possible. At this juncture, I want all of us to rise and the national anthem.